Hello and welcome to Bottom Line. Well, it's here and it's for real now. The number of confirmed COVID-19 cases spiked to 5 in Assam in the last 24 hours. From no confirmed case to 5 cases within such a short period of time is that kind of scenario which immediately sounds the alarm bells. The bigger concern here is that the numbers may increase further. Well, over 400 people from Assam attended the Tablighi Jamaat at Nizamuddin Markaz. Of this, 347 are back in the state, 230 have been identified, samples of close to 200 of them have been collected and are being tested across testing centers in Assam. On top of that, over 117 to be precise, are yet to be traced. Now, this is how serious the situation is. We still have a potential over 300 odd people who have to be tested, and it doesn't end there. If some among them test positive, massive contact tracing efforts would be required to again identify every single individual with whom they might have come in contact. While the number of Markaz attendees are limited in other northeast states like Meghalaya, Manipur, Arunachal and Nagaland, there is still no room for complacency in those states as well. In Manipur, 9 of the 10 samples sent for tests have thankfully tested negative. However, 4 more people, 14 in total had gone, 4 more people from the state are yet to be traced. In Arunachal, meanwhile, 17 people who attended the Markaz are in quarantine and their samples are being tested. But the suspect numbers may be low in other northeast states. But if Assam is affected, there is a high risk for other states as well. That's why it is critical. So where are things headed? Is it important? Yes, I say, is it important to be scared at this moment in the wake of this rise in cases in Assam? Because people in the state have been violating the lockdown norms in the state, and if they have not realized it yet how serious the situation is, this is the wake-up call. Well, to discuss where does Northeast and Assam in particular stand at this moment and much more, I'm being joined by Dr. Nabojyoti Gogoi, who is the Integrated Diseases Surveillance Officer and SDMO Dibrugarh. Very warm welcome, sir, to the show. Dr. Sangeeta Datta, psychiatrist, is at our studios in Guwahati. Northeast Life Editor-in-Chief Vasbir Hussain is also joining me from Guwahati. Spokesperson of Assam BJP Rajkumar Sharma will join us in course of the discussion from Guwahati. From Manipur, I'm being joined by Rinku Khumukcham, editor of the Imphal Times, and our Meghalaya Bureau Chief Roshan Rai and Itanagar correspondent Indu Chukku will join us over the phone later in course of the discussion. If I can go to Dr. Gogoi first in Dibrugarh. Well, Dr. Gogoi, how critical, how serious is the situation in Assam as we speak?
Yes. Since yesterday, the situation seems to be very alarming for the state of Assam. So long we had been good so far protecting from the COVID. Thing is that here, this is going to come, we knew. And most of the virus that emerged in anywhere in the world, it all had came. So likewise, this is the nature. We can't protect. The virus doesn't know the geography and is going to come anywhere. So the most important thing here is that we've been missing those cases. There are many probably roaming around in Assam. And one of the most deadliest part of it is because a person who is infected start giving infection to others before he develops a symptom. So that's why there are a lot of people maybe roaming around. They are not showing any symptoms right now. They may be spreading the disease. So that's why we've been urging people to stay inside, break the chain, stay safe, don't try to communicate so closely, make a social distance that work properly. Everyone should follow the rules and regulations and stay safe out here. Wash hands, respiratory etiquettes, and all those things that had been told, that has been already been circulated to the entire world. So everyone knows. The simple thing is that it's the universal protection for any sorts of respiratory infections, not only COVID. If we take the universal precautions for respiratory illness, then we can prevent COVID.
Dr. Gogoi, around 117 of those who attended the religious congregation in Delhi are yet to be identified, yet to be traced. They, as you just said, they may have come in contact with a number of people. Most of them came to the state after March 16th.
Yes.
They must have spent over a week or more already in the state. So as of now, what is the number roughly? We cannot say, it's not, the calculation is tough, but roughly how many people, would we have to test, in the days to come? How big the number can get? Can we take a guess on that? Because it's not just those 117, the other 230 who have been identified, the 347 who have returned, all of them have definitely come in contact with some people.
Yeah. See, since yesterday we got information about 10 to 12 people, those who have been entering our district. I can talk about the district only. So since afternoon yesterday, we had been searching those cases. Finally, up to 6 o'clock, and up to 6 o'clock we could find 27 of them. Those were in close touch with them, and few of them who has come from Jamaat, from Delhi, and there are a few those who have been traveling along with that. We also picked them up. The number was 27. All of them were tested overnight yesterday. Luckily, they came out to be negative. But we asked people of Dibrugarh to please come forward and give us informations. And those who are hiding themselves up, please let us know. There's no harm. Make yourself safe and make this country safe and make the people safe. So we asked, we have spread the news all over with our ASA workers and MPWs. They have been spreading the news. And finally, we could get another 28 of them coming today. So we have taken by this evening, we have finished taking samples from all of them. There were a few those who were lying. I know there are cases, they might be lying. So there are proof. That's why we didn't spare anybody. He may be someone saying he's coming from Delhi, someone saying no, he's saying no, I'm not coming from Delhi. If they're in a confusion, we are taking them in for our testing also. We are leaving no stone unturned regarding searching those people out here in Dibrugarh.
And do you have the names of, we have the travel history of most of the people. Do you also have the names of all those people who may have traveled from Delhi during that period of time? Is that available, or that process is still on so that we can identify more people and probably step up the contact tracing?
Yes, we have got few names from the contact tracing. Sorry, I cannot express it in the news. I cannot make it public.
Absolutely, I understand.
That's our ethics. Our ethics doesn't say this.
All right. If I can go to Wasbir at this point of time, Wasbir, well, this is now critical. 5 cases in less than a day's time. Well, this was coming probably. This was coming. We all knew that till April 9th or 10th, it's going to be critical for Assam, and that's why we had, several calls, repeated calls from the authorities, from the government, not to violate the lockdown norms, and we know now why.
Absolutely, Nabarun. As we all know now that COVID-19 or the novel coronavirus is a super virus, and what even took place in New Delhi's Nizamuddin, that has turned out to be a super spreader, and Assam has not been left out of the impact. So that is what has actually happened. Till yesterday, we were, sitting comfortable until the first test was recorded and confirmed, and today the 4 cases. And as we have been informed by none other than the Assam Health Minister, Dr. Himanta Biswa Sharma, all the 5 people had gone to that Markaz event at Nizamuddin in New Delhi. But, only the saving grace, is that the preparedness. Now we know why the Assam government, led by Chief Minister Sarbananda Sonowal and the Health Minister, Dr. Himanta Biswa Sharma, had been going all out in leaving no stone unturned, actually, in installing, all the quarantine facilities, coming up with makeshift hospitals, converting medical colleges into exclusive COVID hospitals, coming up with that, unprecedented arrangement with the private hospitals, where they are going to take the load of the normal patients, and all these things. Looking back, now we realize that at least we are prepared. But therefore, there is no cause for alarm as such. I would rather beg to differ with what Dr. Gogoi has said, that it's alarming. I would say that when a virus like coronavirus, as I said, super virus, it spreads far and wide. Look at the developed countries, how it is spreading in US, UK, Spain, Italy, and therefore, in a country of 1.3 billion people, we are doing quite well. But we, as you said, Nabarun, lockdown is the key. Enforcing the lockdown is the key. And nobody can enforce lockdowns in a situation like this until people like us, the common people, demonstrate their responsibility. This is the time to demonstrate responsibility. And as the Chief Minister and the Health Minister reiterated even today, that please enforce the lockdown, please follow the lockdown, stay home and help in fighting the battle, Nabarun. And the challenge for the authorities is to find out if 117 people, because rest of the 456 people who had attended that Marka's event, they have already been identified. They are in quarantine, but 117 people are still at large. And the manhunt in Assam is going on, just like the manhunt all across India, where hundreds of these people have actually dispersed.
Well, yeah. Dr. Sangeeta Datta, is it time? I mean, we have kept on saying that there is no need to panic, things are under control, and that the authorities have put in all preventive measures in place. But is it also the time to say that yes, people should also be scared? Why I am saying this, because we have seen rampant violation of lockdown norms across the state. The scenes coming in, the visuals coming in, people are out crowding the markets. Yes, there is a need, but it's also important to follow the lockdown norms because it's critical. It's a national emergency, and we all know why. It's about life and death. It's a life and death kind of a scenario. Even though the mortality rate is not more than 5%, still lakhs of people are getting affected.
Yes.
So probably people should also be scared now that the number of cases have risen to 5 within a span of 24 hours.
Yes, I wouldn't say that people should be scared and people must not panic. But having said that, I would say that people must be careful, they must be cautious, and they must not violate the norms of lockdown. And having said that, I've even seen in social, I have seen social gatherings, especially in marketplaces, just I think yesterday and this morning, where people have actually crowded and they haven't followed social distancing also. So here we need to understand three things. Number one, for people, Wasbir has just now talked about social responsibility. I think that needs to be addressed. Every human being needs to be socially responsible now. When you are following lockdown, you are protecting yourself, you're protecting your family, and you're protecting your community, your society. That's important. So another important thing is that if someone is carrying the virus, he or she may be asymptomatic, no symptoms at all, and yet he can be carrying the virus and he can be transmitting the virus. So the 5 cases that we are talking about, which we have discovered in the last 24 hours in Assam, that is perhaps just the tip of the iceberg. We are, that's my feeling, personal feeling, that maybe we are going to see more cases in the coming few days. And I anticipate that, and a lot of us are anticipating that. Having said that, please don't panic, but please cooperate so that we can break down the chain of viral transmission. That is important. Some people, according to me, when I see them behaving very irresponsibly, I feel they are still not aware. They have been seeing this in news, in TV programs, in newspapers, etc. But I think they're yet to realize what is the exact situation and how dangerous this situation could become even in Assam. That is one thing they need to realize. Number 2, again, it's about social responsibility. And I guess there is something called denial also, which is an immature defense mechanism which we talk about in psychology, which means that people somehow, a section of people somehow perhaps even feel today say that I have my immunity, nothing can affect me, and they're not bothered about what will happen to the other person who's next to them. So instead of being so indifferent and instead of being so socially irresponsible, please follow lockdown, stay at home. If you have to move out for something very essential, then please follow that, repeated hand washing, social distancing, etc. and be a responsible citizen at least now.
Absolutely. Rinku Kumukcham, editor of the Imphal Times. Well, of the 10 samples from Manipur, those who had attended the markers, 9 have already tested negative, thankfully. But can Manipur be complacent?
Let me tell you one thing. The thing is that we have been exposed to the virus at some place which we do not, we do not, we have never been expected. The thing is that when reporters here in Manipur reported about the thing, there were so many criticism regarding that coming in. Why was that? That was the main question which we have been asking. When Pokna Firm, one of the largest, daily newspaper here in Manipur, and then People Chronicles is sister concern of that, and then Imphal Times, my paper report that we have report that 85 people, might have been infected in this area because of the trash that may make through, this mobile tracing. So when we do that, we don't say that all the 85 people have entered the state. What we have been telling them is that 85 people who have been using mobile from the state of Manipur have been attending or either presented in the in that area. So there is a possibility, big possibility, that these people got affected with this virus.
Basically,
So
the situation. Basically the situation is more complex than it seems at hand. There is no room. There is no room for complacency at all. If I can go back to Dr. Gogoi again. Dr. Gogoi, in today's briefing, the Assam Health Minister clearly said that yes, the numbers may rise and may rise as early as today evening. What are the figures probably you are looking at? I know these figures cannot be predicted, but then we also have to keep in mind, if we take into account the situation in other states, be it Andhra, be it Tamil Nadu, be it cases in Delhi itself, be it cases in Maharashtra. A lot of people who had attended the markers at Nizamuddin are testing positive. For instance, we had around 43 cases in Andhra itself of people testing positive. So, are we staring at a double-digit figure?
For a time, let's forget about the numbers, because counting numbers is no way going to help us to prevent all this disease. Thing is that we'll have to understand the science behind this disease. I just want to express this a few words here. First thing is that the respiratory etiquette. Why you are saying to maintain the respiratory etiquette and washing hands. Okay, the reason this is no longer. Hello.
Yeah. I can hear you.
Yes. Hello.
I can hear you. Go ahead.
Okay. The thing is that this virus is no longer a new virus for us. It was new for China. It was new for a lot of other diseases, but we got enough time. There has been a lot of studies made of this disease. We should be very scientific. Recent studies says because it goes in droplets, and sometimes they talk about, the scientists talking about the micro droplets also. If someone cups, a patient cups inside a room or where aerosol generating procedures are there, and where there is a closed room, not well ventilated, then the virus can float for hours together. It can be airborne. That's why I'm saying that that's the reason why we should maintain a respiratory etiquette. Anyone, whoever is having influenza-like illness, it's a must. He'll have to wear a mask. And people, those who are wearing, a lot of people are wearing masks to prevent themselves. I'm giving here, I would like to warn here is that no mask is complete airtight. To be very frank, not to be scared, to be very frank, I'm saying no mask is airtight. So maximum surgical mask you're wearing is a lot of holes are here and there. So it cannot be airtight. So when we breathe, if it is in the aerosol, if the virus is there, if someone coughs in front of you, a patient coughs or a patient sneezes in front of you, if we are near about less than 2 meter distance, then there's every chance that we can inhale it. This virus cannot penetrate the skin, mind you. This virus cannot penetrate the skin. We'll have to get it through our eyes, or we'll have to get it through our nose, or through our mouth and mucosas. That's very clear. That's what been proved scientifically. So we'll have to be very scientific regarding this to prevent this. If you don't, a lot of our people, they don't understand. They're taking it very simple. They're thinking that they're wearing a mask and they're safe. No way. Even if they're wearing a mask, they are not safe. I'm telling you. Those who are infected, they will have to wear a mask. That's my takeaway today. For the takeaway message I would like to give is don't take your hand to your eyes, nose, and mouth. Even if you touch, suppose a virus, you have by mistake you have touched anywhere in a railing where an infected person might have touched. If the virus got attached on your hand, it's not going to penetrate until and unless you take that hand to your eyes, nose, and mouth. So if you wash that hand, if you make a practice, keep on washing your hands throughout the day. When you take your hand to your mouth and nose, then you can prevent this disease. These are simple steps, simple thing that should be clearly made to the public. Everyone should understand this to fight this disease.
So basically there are two golden rules. I say golden rules because it's very important. First, don't, when you're outside, don't touch your mouth, your eyes, your nose. Do not. And secondly, all of us should be wearing masks, not because the mask will protect us, but it will protect others. If I am carrying the virus and I am not showing symptoms till now, if I wear a mask, I prevent, I do not spread it to anyone else. So this is something that everyone should follow. I should wear a mask so that somebody else can be protected. Wasbir, this is very important, this sort of information, because there is a lot of information being circulated in social media and WhatsApp groups, and there is a lot of confusion. So it's very important that these things are made public and in very simple language, so that everybody knows what to do and what not. And clearly there is no alternative to social distancing or physical distancing, if we may call it. Wasbir.
Absolutely, Nabarun. These are some of the basic do's and don'ts that, starting from the World Health Organization to the ICMR to the health authorities to now doctors like Dr. Gogoi, who is sitting on our panel today. All these responsible people and authority who are well adept in the subject, they have been telling the people. Now the issue is that, we have certain responsibilities. Everybody has to perform these responsibilities at this point in time. I would like to, since we are talking about a time when from 24 hours, we have now 5 cases in Assam. And I am pretty sure that by tonight or tomorrow morning, it will touch double-digit figures, because these, I'm saying, going by the trend of the people who had attended that Marcus event, and the number of people escalating, the number of figures rising of people who are attending being tested positive in various parts of the country, whether it is Maharashtra, whether it is Andhra Pradesh, whether it is Telangana, and so on and so forth. And now we may soon get double figure or double digit. That is a different story. But the story is how to, how to find out these 117 people. Now here the community has to play a big role. By community, I mean I'm not talking about the Muslim community alone, because all of the people who had attended the Markaz were Muslims. But now it is the incumbent upon the community leaders of whether it is the masjid committees, whether it is the dargah committees, or anybody, to find out these people, 117 people, and they themselves, the family, have to come forward, whether it is by calling 104 or by telling the nearest police station, or by telling the nearest circle officer or the BDOs, and whoever you get, even the ASA Karmis, they'll be all out to help. And as the Health Minister, Dr. Himanta Biswa Sharma, very rightly said this morning, or this afternoon rather, during the press conference, he said that, this COVID-19 doesn't carry a stigma of HIV/AIDS. Therefore there is no problem in telling that that someone is having symptoms of COVID-19, or even if that person is tested positive, there is no harm in telling, because once you are cured means you are cured. Once you are cured and your test turns negative, then you are not likely to spread the disease or spread the virus anymore. So these are things which have to be made aware. My appeal to the Assam government at this point in time, or for that matter the governments in the entire Northeast, is to come up, print some of these simple do's and don'ts, simple facts, print a fact sheet in the respective dialects, respective languages, local languages, and distribute it amongst the people. Now, do's and don'ts, if somebody may be fearing that there could be stigma attached, oh, what will the society think? I might be socially ostracized. There is nothing like that, actually. Actually, the safety means, the moral of the story is that please come forward, declare that you are having symptoms. If you are tested negative, it is well and good. Even if you are tested positive, the mortality rate is rather low. And if you don't have the accompanying problems, then there is very little chances that you are going to die. So therefore, please come forward with information,
Yes.
get treated, get well, and live freely and happy.
It's a less than 5% mortality rate, and it's not as fearful as it seems. The number of cases in Assam has gone up to 5 today. All the other Northeast states are also concerned. So what are the preparatory measures that we are looking at? If I can go back to Dr. Gogoi again. Dr. Gogoi, yes, Assam is perhaps the only state in the country which has made massive preparations, exemplary. So despite this spike in numbers, would you say that still now Assam can claim that yes, we are comfortably placed, we can handle this, we have the necessary capacity building measures in place, and there is no need to panic? The medics, the doctors, the frontline health workers are upbeat, and we will take it as it comes. Of course, we need cooperation from the general public.
Yeah, there is a very good spirit amongst us, in our professionals, right from ASA workers to the top level. We have been preparing it very well. Since last 2 months have been very hectic for us. In Assam Medical College here, Dibrugarh, we have prepared lots of ventilated beds and all that, everything been prepared, ready. And there are 5 more quarantine centers we have developed, and even if required, we will use those quarantine centers for treatment also. See, the thing is that what the message I want to give here is it's a fight for us. We are taking it on. It's the time for us to show our excellence here, and it's on. What we need is your blessings, people's blessings. That's why I would like to request the people through your channel, please be calm and please listen to us, be scientific. There are very simple steps what I told. Please follow that. Please follow that to help us also. We are preparing in such a way that some of our workers will be working for 7-8 days, then they will get a break, then they will go for quarantine, then another batch comes in, they will treat the people, they will go for quarantine. And this way, our doctors will stay there, so they will not get a chance to come back for home also. So it's a very tight plan we are making it, and it's a very courageous and very compact plan to safeguard the people of Assam here, and we are ready for it. We just need your blessings.
Now, Dr. Gogoi, before we let you go, I know you're busy and you have to go. My last question to you, again, is a second testing mandatory in all the cases? Secondly, we also had information today that yes, some cases have tested positive as far as the screening is concerned, but that cannot be taken for granted. A second test is mandatory, a full-fledged test is mandatory. In the coming days, God forbid, if the numbers increase, if the numbers increase, would we still have the wherewithal to go for mandatory second tests? That is the fear that many have. And is second test very much mandatory to confirm or declare somebody as COVID-19 positive?
Yes. Yes, yes. The thing is like that. If someone who is in quarantine, suppose he has developed flu-like symptoms, it will be for 14 days. Suppose he got cured in between, and then he might get an infection again. Then we may go for a second testing during that period. If it comes negative, suppose on the 5th day, then we'll go for testing another test on 14th. And before declaring that person is cured of COVID, we need 2 testing in 24 hours apart. He'll have to show it negative. Then only you can discharge that and declare that person is free of COVID.
Another last question. Again, it's about public.
And more of that.
Go ahead.
Just a minute.
Yeah.
Just a minute. Thing is that which we require. That's my personal opinion. We feel we must go for more testing than the present what you are doing. What we are doing is that it's a Government of India guideline. Of course, we need to follow. Only the presenting symptoms are there. Those who are presenting symptoms and those who have come from affected area, they do have contacts and all that, and they have traveled together for hours. There are some definitions, case definitions. We are following that, but we need to follow. The state governments follow. But personally, I feel we need to go for more testing.
And again, my last question. Well, this is for public awareness. As we just mentioned that everybody needs to wear a mask to protect others. At the same time, we shouldn't be touching our face. If we are talking to someone and not maintaining a 3 feet distance during these times, are we at potential risk?
Yes, definitely. Even if you are wearing mask, if you are close to a person you are talking, someone is infected, then while there's a recent study that said micro droplets. Even if someone near in 1 meter, suppose in between 1 meter distance, closer, a person is talking loudly, then he may spread some micro droplets, and that's also causes infection.
All
that's
right,
a very recent study,
yeah.
and that reveals, yes.
Yeah, go ahead.
Yes, that's why we need to be keeping distance. Even if we are wearing mask, we'll have to keep a distance minimum 2 meters away. If you are in a closed room, maybe stay for a safer this thing. You'll have to go further away from there. The more the distance, and then the less the chance you're catching the disease.
All right, Dr. Navajyoti Gogoi, thank you so much. Thank you so much for your precious time. You people, the doctors, are the heroes for us, and all our good wishes are with you. If I can go back to Dr. Sangeeta Datta, well, see, it's more of a social responsibility now.
Yes.
It's more of a social
Yes.
responsibility. We have to protect ourselves, and we have to protect our near and dear ones, and we have to save our society, our community, the people we know, the people who are near and dear to us, because this is something, that possibly humanity has not faced such kind of crisis in decades.
Yes.
And these are difficult times, and they need tough measures. We have to make some sacrifices. The visuals, the size that we see, people crowding, of course, people don't do it because they like it. There is also a need
Absolutely.
thing. And there's no denying to that, but still, we have to save ourselves first. We cannot get infected.
We have to understand priorities too. When it comes to fulfillment of needs, like people are hungry, they need their essentials, but then we have to think about our priorities. The priority is to save ourselves and our near and dear ones, and also the community. When it comes to social responsibility, of course, when we talk about social responsibility, the things that have been mentioned are important, like maintaining the norms of lockdown, that is number 1. Number 2 is maintaining social distancing. Number 3 could be repeated washing of hands. Number 4 could be not touching your mouth, nose or eyes, like Dr. Gogoi has said, and also following all the respiratory etiquettes. But in addition to that, what has happened in the last 24 hours, I think people who are socially responsible, they should actually come out and contact 104 and get themselves tested. Instead of the government has done a wonderful job by actually trying to trace the contacts of these people, or people who had actually attended this religious congregation. But having said that, don't do we think that we are mature enough and socially responsible enough to actually come out by ourselves and to contact 104 and get ourselves tested? Like Wasbir had said a short while back, which is very relevant here, that please do not feel ashamed to get yourself tested. A lot of people, in fact, I have come across, have even said things like this, that to be quarantined is like being imprisoned. No, you're wrong. You're not being imprisoned. It is a very routine procedure which has to be followed if we have to fight this war against COVID-19. And please come out, get yourself tested, and that way it'll be an easier job for the government, because otherwise it'll be impossible for the government to trace every contact, because every contact again has perhaps a lot many other contacts. So please help the government also perform their job, you know. I mean, the way things are done, it's done wonderfully.
From a psychiatrist's point of view.
And another thing, Noborun, like Wasbir had said, I'd like to, repeat that. There should be no stigma attached to this. To be COVID-19 positive, it is not a stigma.
Absolutely.
Because you get it through droplet infection. You haven't done something which is unethical or which is immoral, like it's considered for HIV AIDS or something else, which shouldn't be considered also. There is no stigma and there is no social ostracization also here. So please understand that and come out. That's important, and follow the norms.
And also from a psychiatrist's point of view, why do you think, I mean, it's not just, let's not take just the Marcus case. We had people coming from foreign countries, NRIs and others who have been coming, taking, medicines to avoid temperature, and even Bollywood actors, singers, skipping quarantine.
Yes.
Why do you think are people trying to avoid this? Is it, I mean, they are clearly seeing it as a stigma, as a shame. I cannot get the virus. It's not me who is spreading that kind of a mentality on display here, clearly.
That is something we call denial. And as I said earlier, denial is an immature defense mechanism of the human mind. It is not a sign of maturity. It shows that you're still immature as an individual and you're not socially responsible. Denial also refers to the belief system that I cannot contract the virus. I cannot be spreading the virus. It can be somebody else. So please get out of this thought process, because you, me, everybody around us, we can be carriers, we can also fall sick, but we can recover. Like it was discussed earlier, COVID-19 positivity does not mean death. The deaths that have been reported has happened in elderly cases and in people who have had comorbid illnesses, other comorbid illnesses. So most of them who were COVID positive, they have been asymptomatic, and some of them who actually developed the illness, flu-like symptoms, they recovered also. So there is no stigma, nothing to be ashamed of. Just be brave, be socially responsible, follow all the norms of lockdown, follow all the norms of respiratory etiquette, wash your hands repeatedly, don't touch your face, especially your eyes, nose or your mouth, and please change your attitude. Please become responsible, at least now, because it is now a choice between becoming extinct as a race or actually living a normal life once again. So the choice is yours.
Absolutely.
And I'm sure it'll be a very, the options are very clear, and we know what our choice should be.
Absolutely. I'm also being joined by our Manipur Bureau Chief, Sharat Chandra, live. Sharat, well, the good thing is that 9 samples of the 10 being sent for tests have tested negative. But also the concern is that the state is yet to trace 4 others who had attended the Marcus. Are they back in the state? Is there any information, or they could be still in Delhi? Any update on that front, Sharat?
Yeah, Nabarun, so far as the participant, I should say, the delegates who have participated in this Jamaat event in Nizamuddin, Delhi. 10 of them, it is already identified by the health department, the state authority, and all the 10 people had already reported, and the sample is also being collected. And so far, out of 10, the 9 result is also already come. This already tested negative. Still, 1 result is still pending. Doctors are this Jennings authority are saying that this result is showing some variation. So the final result will come to know by only tomorrow. This is the latest update. And so far as how many people participated in the Jamaat in the Nizamuddin, actually 10 people took part in this Jamaat in Nizamuddin. And so far, the 9 have already come back. And also, we do have the report that another one who took part in the Jamaat in the month of December, and also he came back to the state in the middle of the December. And 10 who took part in the March event, this Jamaat event. 10 of them, 9 have already reached to the Impal, and another one is still at Delhi. So far as another 4 is concerned, the organization, this organization name is the Darul, Marcus Lilong is the sole organization, felicitating the delegates, sending delegates. This is the organization looking into the delegates. So they do have the exact list. According to them, 10 have taken part in this March event, Jamaat event in Nizamuddin. And yes, people do talk about the 4 also, but the 4 people, they went to Delhi, but they didn't they didn't take part in the Jamaat event. This is the report so far. And state government, particularly the health department, is looking into the matter, very, very vigilantly.
So those 4 people were also in Delhi round about that time, probably between March 5th, 6th to March 16th, 17th. Is there any information on that? If they were also in Delhi round about the same time, and have they returned to the state? Have they also been identified? In case, because
Yes,
not everybody. Yeah. For instance, in Assam, not everybody. Go ahead, Sharat. Go ahead.
Yeah, so far as the 4 people, four person who went to Delhi but didn't take part in the Jamaat at Nizamuddin. Yes, the authority, the government is also trying to locate the people to identify. Still, the effort is on. I think by tomorrow, I think the authority will try to locate those 4 person who went to Delhi but didn't take part in the Jamaat event at Nizamuddin, Nabarun.
All right, Sharat, my last question to you before I let you go. How is the UK return girl who was the first from the state and the region to test positive? How is she doing? Is she recovering well? How soon can she be released? Any updates on that, Sharat?
Yes, from the Zenim's authority, we do have the information that that particular 23-year-old girl who is having this travel report of coming back from UK and tested positive on 24th of March. Now her health condition is gradually improving according to the doctors attending to her. This is again a psycho relief that girl health is improving gradually, Nabrun.
All right, Sharaf, thank you so much for all those updates. Well, we are also being joined by Rajkumar Sharma, spokesperson of Assam BJP at this point. But before I come to you, Rajkumar Sharma, my last question to Wasbir. Wasbir, everybody was talking just probably 2 or 3 days back. Everybody was talking about, well, not everybody, but some people maybe thinking that why is Assam making such massive preparations at a time when there is not a single case in the entire Northeast. But today, all those steps taken stand vindicated, Wasbir.
Well, as I have said, Navarun, this is a super virus. This can spread. This doesn't know any boundaries and doesn't know any geography. And
okay, we are facing,
direct foresight is
we are facing some connectivity issues.
All right.
We are facing some, we can hear you now, Wasbir. Go ahead.
Okay. No, my point is that I said this was a super virus, and therefore any government that has foresight would definitely prepare itself to deal with any eventuality. And that is what has been done by the Assam government, led by the Health Minister, Dr. Himanta Biswa Sharma, and his deputy, as of course, the Chief Minister and others. Now, the point is we are well prepared, and that is a little bit of a relief for us that at least the state has the basic infrastructure now, at least to deal with the crisis. Of course, this is something which we cannot lower our guard. It can come in various manifestations. We have to wait and watch as to how things unfold in the days ahead, but it is for certain that within the next 24 hours, we are going to get, whether we like it or not, it is a super virus that is spreading fast, and we are getting to know more numbers which will emerge positive. But then, as I said, my concluding point will be that we don't need to be go on a panic mode. We don't need to be absolutely alarmist, but we have to be prepared to deal with the situation, and every citizen has to demonstrate his or her unique responsibility at this critical juncture.
Absolutely, Basbir. Thank you so much for your perspective. Thank you so much, Basbir Hussain. Rajkumar Sharma of the BJP. Well, time has now come to completely, enforce the lockdown, which we have not been able to do so far completely.
See, Navarun, hello.
Yes, I can hear you. Go ahead.
See, Navarun, our people have to understand the importance of lockdown, first of all, because till yesterday in Assam, people were taking very casually, and everybody was saying the data of all over India and comparing the data of Assam, and people were saying that यहाँ तो कोई case नहीं है. And then as you asked to ask you also that why preparation was made. But from yesterday evening, there is a panic in the mind of people. Even in my locality, I have seen people have closed their gullies, like street also. All street have been closed and they are not allowing public to come. So I think from today onward and after 2 o'clock when Hemant Biswa Sarma's second press conference regarding declaring 4 more COVID patients, people have become more panicky, and I think they will more follow the lockdown rules. But we have to understand, especially the people of Assam, the importance of lockdown. It is not made for the sake of fun. Government doesn't want that lockdown should be there because there will be huge economic crisis also. But the government thought that life is more important than economic development of the country. So considering the thought of Modi ji and the government, that this is really a need of hour, everybody must follow the rules of lockdown. Otherwise, government has to become more tougher on this issue. And the problem is all over India that people are taking it very casually now.
Rajkumar Sharma, my last question to you. Yes, we don't want to spread panic. Everybody should be careful. Everybody should be aware. But sometimes, for a situation like this, especially when we are still seeing, people rampantly violating lockdown norms, least regard for social distancing or physical distancing, we must say sometimes darna zaruri hai. Darna zaruri hai is also important.
This is very important. Darna zaruri hai, as you said. Panic is very important in the mind of people because I personally am feeling from yesterday onward, people are more aware about this. Till yesterday, people, whenever I used to talk to public in my locality also, because I am not going outside, then in my locality, whenever I used to say, thoda dhyan rakho, everybody was having the opinion that there is no cases in Assam and Assam will be safe. And people were very happy that Assam is going to make a history. But suddenly, because of this Tablagi, that issue in Markaz, Assam has also become in the map of COVID-19, which was not till yesterday. We were showing a real zero figure, and we were very happy that our government's performance will be appreciated by all people of India. But till from yesterday onward, we are also panicked what will be happening because the number of people who attended this Markaz and 350 people have come to Assam and 170 people are not able to test out. So see, the problem is these 350 people must have met lot of people. So I don't know how long.
Yeah, but at the end of the day, the good thing is that the Assam government had the foresight and had made all the elaborate preparations
we must appreciate the proactive act of the Assam government, especially Dr. Hemant Biswa Sharma, as well as our Honorable Chief Minister of Assam, Sarvanand Sonowal, both there, and especially I will refer the name of Piyush Hajarika also. Especially the health ministry has worked very wonderfully, and as on today we are ready to handle more than 5,000-6,000 patients.
We hope
Today
we don't
are
have
ready.
to. We hope we don't have to. Thank you so
And
much. Yeah.
I expect that this
Yeah,
number should not exceed
I
by the
am
grace
running
of
out of
God.
time.
And thank
Running
you,
out of
thank you.
time, running short of time. Last words, Dr. Sangeeta Datta, very quickly.
Everything is fair in love and war, they say. And this is a war against a very powerful enemy, which is COVID-19. And to win this war, we'll have to follow all precautions which have been prescribed, be it lockdown, be it social distancing, be it repeated washing of hands, or be it anything else, even about coming out and getting yourself tested. We don't want to lose this war.
Absolutely,
So let us win this
absolutely.
war and let us be together.
Absolutely.
Let's stand united.
Absolutely. We have to win this war for the sake of humanity. Yes. Thank you so much, Dr. Sangeeta Datta. Thank you so much, Rajkumar Sharma, for your precious time. Thank you, everyone who joined us on this show. That's a wrap.